Understanding trauma and addiction, it's like trying to solve a puzzle where all the pieces are interconnected. You know, I used to think these were separate issues, but the reality is far more complex. Let me share something important. When someone experiences trauma, their brain literally rewires itself as a protective measure. Think of it like your brain creating an emergency exit plan. And sometimes, that plan involves substances, drugs, alcohol, anything to numb the pain or escape the memories. Here's what's fascinating. Research has shown that up to 75% of people in addiction treatment have experienced significant trauma in their lives. That's not just a coincidence. It's a clear pattern that tells us something crucial about human behavior and coping mechanisms. I remember meeting Sarah, not her real name, a recovery counselor who completely transformed her approach after understanding this connection. She told me, once we started treating both the addiction and the underlying trauma together, everything changed. It was like finally having both keys to a double-locked door. But here's the thing. This understanding isn't just about treatment. It's about changing how we view addiction itself. Instead of seeing it as a moral failing or lack of willpower, we start recognizing it as a response to deep emotional wounds. It's like treating a broken leg. You wouldn't just focus on the pain. You'd need to set the bone and allow it to heal properly. The implications are huge. When treatment centers adopt this understanding, they create personalized plans that address both issues simultaneously. It's like weaving a safety net with two different types of rope, both equally important for strength and support. And the results? They're remarkable. People in recovery who address their trauma alongside their addiction are significantly more likely to maintain long-term sobriety. They develop healthier coping mechanisms like mindfulness, therapy, or support groups, instead of reaching for substances when triggers arise. But perhaps most importantly, this understanding helps reduce the stigma around both addiction and trauma. It shows us that addiction isn't about weakness. It's often about survival. It's about human beings doing their best to cope with overwhelming experiences. The path to recovery becomes clearer when we embrace this holistic view. It's not just about stopping substance use. It's about healing the whole person, mind, body, and spirit. And that's what true understanding brings. A chance for complete healing, not just managing symptoms. Remember, every person's journey is unique, but understanding these connections gives us the tools to create more effective, compassionate, and lasting solutions. It's time we looked at addiction through this lens of understanding, because sometimes understanding is the first step toward healing.